be informing you about a herniated disc. In 8th grade, I decided to join my school's football team. After a few weeks of practice, I noticed I started having a sharp pain running down my left leg just below the knee. After about a year of these symptoms, I decided to go to the doctor, who prescribed an MRI. The results of the MRI came back and informed me that I had a herniated disc in between my L3 and L4 vertebrae in my lower back. After a few years of treatment and physical therapy, the symptoms still persisted, and today I still have adjusted to live with these symptoms. Today I will inform you what a herniated disc is and how they can be caused, the different treatment options for a herniated disc, and the different methods to reduce the chances of receiving one throughout your life. A herniated disc, according to the Cleveland Clinic, occurs when pressure from the vertebrae above and below a disc between the vertebrae forces the fluid out through the tough exterior of the disc and places pressure upon the nerve. It places pressure where the nerve exits the spinal column and goes to the limb. So for me, it goes from the nerve leaving my spinal cord, the spinal cord, down to my left leg. It can occur anywhere down the spine, including the neck, the torso area, and then the lower portion. And then the pain can result in the nerve afflicting the ligament. There are many causes that can cause a herniated disc, including old age and deterioration, unnatural contortions of the spine, which is most common in gymnasts, or excessive force due to improper weightlifting or an excessive hit or force of trauma. The treatment options for a herniated disc can involve eliminating the pain completely or reducing it slowly over time. The first and most basic method is core strengthening. This involves strengthening the muscles around the back to help support and protect the spine and eventually reduce the swelling of the herniated disc. This, along with good posture and a healthy weight, can help reduce it over time. And according to the Mayo Clinic, 9 out of 10 people will find relief from this method within 1 to 2 months of regular exercise on their own. A second method is cortisone injections. This anti-inflammatory steroid can reduce the swelling of the disc and eventually relieve the pain. A third and the most severe method is surgery. This is usually held as a last resort or for people who have symptoms that are too extreme to function in daily life. The different types of surgery that can involve removing the protruding portion of the disc or removing the disc entirely and fusing the two vertebrae together, which would reduce your flexibility. A study published in the New England Journal of Medicine by Dr. Cole found that surgery helped relieve pain faster, but the recovery time was much longer, and most people were recommended to do this core strengthening and physical therapy instead. Finally, I would like to talk about reducing the chances of receiving a herniated disc. No one can completely prevent their chances of this happening, but there are ways that you can help to stop it from happening to you later in life. The first method is, like I said previously, is to maintain a strong core. By working out your lower abdominals and back muscles, you can strengthen the muscles around it to protect your spine, so if you do receive a hit or contort your back, they'll help to support the back and you won't receive it as easily. A second method is to maintain a healthy weight. Excessive weight can lead to strain on your back over time, and then it will eventually lead to a herniated disc. By reducing excessive weight, you're also reducing your chances of receiving a herniated disc later in your life. A third and final method is to avoid improper lifting techniques that can strain the back, which is why people always say to lift with your legs and not your back. To avoid harmful contortions to your spine and stretching before activities, and by avoiding dangerous impacts like in football or a car accident. In conclusion, a herniated disc is a common injury that can happen to anyone in life. There are many different treatment options, but the most basic method is to maintain a healthy weight and to exercise your muscles. Before being exposed to this injury, I recommend these few preventative tips that can be taken to reduce your chances and can help you to remain healthy and active throughout your life.